Physical examination of diabetes.
Hello, Tone. How are you?
Hi Mew, I'm fine. Thanks. How about you?
I'm all right. Where have you been?
I am coming from a group discussion session.
What was the topic?
It was about physical examination case of hyperglycemia under investigation.
I see. Would you like to explain?
Sure, why not? This is about how to physically examine a man, aged 58 years, coming with the symptoms of hyperglycemia.
Is there a specific examination method available for people with hyperglycemia complaints?
There are no specific methods available. However, it is important not to miss certain things.
Such as?
Firstly, look for appearance. A hyperglycemic person often appears exhausted due to high blood glucose levels. They also need to frequently urinate during the night times, and may lead to loss of sleep and cause fatigue. Most hyperglycemic people are obese, and their waist circumference is often well above 95 centimeters.
Interesting.
The next step is, do a complete physical examination, in which we examine every system to make sure we record any existing comorbidities.
Why is it important to do a complete physical examination?
It is not to miss any systemic illness. And most hyperglycemic patients do suffer from other illnesses, particularly metabolic disorders.
I understand. Please go ahead.
In the systemic examination, we first check cardiovascular and respiratory system by looking for the signs of pallor, bilateral lower limb edema, breathlessness, cyanosis, and so on. Followed by gastrointestinal system. The next is to check for signs of liver diseases such as jaundice, abdominal pain, itchy skin, and scratch marks. Notably, ruling out dark-colored urine and pale-colored stool is important while history taking.
How do we examine pancreas and spleen?
While we are thoroughly checking gastrointestinal system, however, pathology of pancreas is often emergency, and most of the patients will need to be transferred to an institution or a tertiary care hospital.
I see.
Let us move on to the next system, that is musculoskeletal system. Look for signs of bone tenderness, bone fracture, head injury from falls due to the episodes of hypoglycemia.
That's very interesting.
Of course. Critically low blood sugar levels can cause falls in hyperglycemia patients. If they miss a meal or two and blood sugar may fall very low.
I see.
The final step, we measure vital signs, including blood pressure, temperature, and peripheral pulse. It is very important to measure the blood pressure and rule out hypertension.
Is it true that all diabetic people will develop hypertension?
That's not true. However, all diabetic people are more prone to develop cardiac diseases as a complication of long-standing high blood glucose levels, or poorly treated hyperglycemia.
Interesting. Thanks for your explanation.
You are always welcome. Great to share this topic with you. See you later. Bye and take care.